Warnock.
Thank you so very much, Chair Casey, and my thanks to you and Senator Tester for holding this important hearing today. First Lady Rosalind Carter, a great Georgian, used to say that there are only 4 kinds of people in the world. She said that there are those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Yet our caregiving infrastructure is falling short for too many, including our veterans. The VA boasts generous caregiving programs for veterans and their families. Grateful for the work that happens there, but 2 of our witnesses today confronted challenges with one federal program intended to financially support caregivers of injured veterans, the program of comprehensive assistance for family caregivers, or the PCAFC. Ms. Nieskens, I am deeply sorry to hear about your husband's grueling experiences with the PCAFC reassessment process. You are the human face of the public policy issues that we're trying to address, and it's important that we center the families that undergo this, the veterans in this work. So tell me, how can the VA improve the reassessment process so veterans won't have to experience the turmoil you and Kelly faced?
The regulatory changes that were implemented, which required ADL assistance each and every time, and supervision, protection, and instruction assistance at a rate of continuous daily care, were exclusionary, and therefore needs such as my husband has for neurogenic bowel and seizure care and things like that, while those are very serious and require constant care, regular care, they are episodic. And therefore, because of that, the nature of the disability itself, they were unable to meet the standard of each and every time and continuous daily care. And so that language is problematic and should be changed.
Thank you so much. Again, you're the human face. It's public policy. Regulations often don't match where people actually live. And so we have to be very intentional about getting it right. Mr. Townsend, thank you for your service and for being here today as a witness. Like Ms. Nieskens, you and your wife encountered barriers to receiving caregiving support. Can you talk about your experience getting connected to assistance after the VA denied your application for PCAFC?
After we were denied access to the comprehensive program, fortunately, we were still able to access most of the benefits. Lisa has since been enrolled in the general program of caregiver assistance, and we're able to participate in benefits such as respite care. We really haven't had. Put it this way: the main benefit of the comprehensive program is the benefit of, at least for me, is the availability of medical insurance coverage through CHAMP VA. The other benefit, obviously, is the financial support through the stipend. We can live without the stipend, but what made it possible for my wife to retire early and become my full-time caregiver was that availability of CHAMP VA. And in our case, since we were denied access through the comprehensive program, fortunately for us, because of the 100% permanent and total nature of my disability rating, we were able to access that benefit through other means, not through the caregiver program itself.
So you were not automatically connected to the caregiver program?
That's true, sir. It's interesting that as we went through the process of the application of the comprehensive program, in our meetings with, for example, the social worker at the hospital, she explained to us that if we were denied access to the comprehensive program, we still would be able to access the benefits through the general program. We assumed that transition from the comprehensive program to the general program would be almost automatic, if we were denied access to the comprehensive program, but come to find out that's not the case. It was only later, when I contacted the staff at the VA in Wilkes-Barre, that we realized that Lisa was not formally enrolled in the basic or general caregiver program. She is now, but it was not an automatic transition. So whatever the committees can do to work with the VA to ensure a more seamless transition between the comprehensive program and the general caregiver program, if you're denied access to the comprehensive program, would be of tremendous benefit. Thank you.
So you both paint a picture of a fractured system where the constituent parts do not talk seamlessly to one another. And so clearly there's room for improvement in addressing the need for continuity of care, making sure veterans don't fall between the tracks. But thank you so very much for your witness and your testimony. I think brings this kind of issue into clear focus and helps us to see the work that we've got to do. Thank you for your service.
Thank you, Senator Warnock.